Westmoreland Community Connections is a presentation of Citizens Fiber.
Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Jennifer Miele, Chief Communications Officer and Managing Director of Evangelization of the Diocese of Greensburg.
Welcome to Westmoreland Community Connections on WHJB. I'm your host, Jennifer Miele. Happy to be here today with one of our favorite Westmoreland County doctors, Dr. Jacob DiCesare, and his wife, Holly. It's been 1 year since Dr. DiCesare started his own practice in multiple locations throughout Westmoreland County, so we're here to do a check-in with him today. Dr. DiCesare, welcome.
Thank you, Jen. Glad to be here.
And Mrs. DiCesare, Holly, thank you so much for being here this morning.
Hi, Jen. Nice to talk to you.
Wonderful. So can you believe it's been a year since you opened new multiple locations throughout Westmoreland County? Dr. DiCesare, tell us about the last year and all the different locations that you're in now.
Yeah, so we just passed a year on June 1st. That's right. And we have been very blessed to be able to take care of people here in Westmoreland County. Right now, we have 3 locations. We see patients in North Hinden. We're also in Greensburg, and we go to Mount Pleasant as well. As you know, we're doing all non-operative musculoskeletal care. We do we treat a lot of different problems for basically all the joints, and use musculoskeletal ultrasound as well as some different type of regenerative injection techniques. So it's been going really well, and we've been really happy to be able to be of service to people here.
You and your wife are the proud parents of 3 young, amazing little boys. And Holly, you've chucked yourself sort of back into the workforce while managing these 3 young boys. Tell us a little bit about your role and what you've worked on the last year.
I would say lately, with them all 3 home from school, I'm doing a whole lot less. But what I do is I fill in, I answer the phone, I run the marketing. And then in the beginning, I was actually doing the billing. But now our office manager takes care of that. So we're really lucky that we have 3 staff working with us. We have Tracy, our office manager, and Ashley and Christina, his medical assistants. So without the 3 of them, we'd be pretty lost. But we're lucky because they make our patient care phenomenal. And that's really one of the benefits of private practice, is that they actually do really care about their patients.
That's fantastic. I know working in the sports medicine field, oftentimes you are the catch-all for anything that hurts. And I can speak from experience over the last year, was experiencing some shoulder pain, was 100% sure that I tore my rotator cuff, but I was amazed at the care when I came into your sports medicine office in North Huntingdon, and that you even had the diagnostic equipment in the office. So tell us about that process, and when people come in pain, how you're able to evaluate them.
Yeah, so that's one of the great things about being in practice, in private practice, is that, you know, we can do exactly what it is that we know the people of this county want. So, you know, if there's something that's better for people, that people prefer, we're able to make the change, as opposed to being in a big corporation where it's sometimes hard to do things exactly as you think needs to be done. You know, for example, if you come to our practice and you call us, someone answers the phone. That sometimes can be difficult in a lot of environments. So we're able to accommodate people faster. As you mentioned, I have a musculoskeletal ultrasound that comes with me everywhere I go. I can take it out like a laptop. I can wheel it into a room. We can see your soft tissue, and that can be helpful diagnostically. It can be helpful if we need to do any type of procedure in the office. And we use it every day, multiple times a day. And then my staff has been with me for 10 years, and they understand how to take care of people very well as well.
I think the the advantage too of having multiple locations is that you're breaking down patient access, right? You're breaking down the barriers to people not wanting to travel because, oftentimes you are working with an aging population in Western Pennsylvania. And, not only do folks not want to drive downtown, they might not even want to drive to a city like Greensburg. Is that one of the reasons that you decided to have multiple locations throughout Westmoreland County?
Well, yeah, so that was something that we always talked about when I worked with Excella was, people from Latrobe don't like to cross over the Mountain View to get to Greensburg and vice versa. And people like to kind of stay in their territories. And that's exactly why I am in different locations. Dr. Esposito, who's a wonderful primary care doctor from Mount Pleasant, she actually called me when I went in private practice and said, why don't you come here to my office? We have all these patients from Mount Pleasant, from Connellsville, who don't want to necessarily even have to go outside of their area. You can come here and serve this area. So it was a great idea that she had, and I rent out of her office space when she's not there, and we're able to serve that part of the community.
That's fantastic. So why don't we go over your locations for just a minute? You are on Norwin Avenue in Norwin, and then do you have the address of your Mount Pleasant location?
It's 599 North Church Street in Mount Pleasant.
Great.
Not very far from Frick Hospital, right across the street from, is that the Marathon gas station, Holly?
It is the Marathon gas station.
Across the street, right. Yeah, so right in Mount Pleasant.
And then the other location?
So we're at 438 Pellis Road,
yes,
which is, on Pellis Road in Greensburg, where all the medical offices are. We're right behind the State Farm building. And then we're in Norwin Hills, Excella Square, in the Medical Arts building.
Very nice. Very nice. And Holly, have you traveled to all of those places and helped get those offices set up? And do you have a favorite?
I have been to every office. Oh, do I have a favorite? That's such a good question. I did the most in the Norwin office, and I decorated it the most. So that one would probably be my favorite.
There you go. They're all...
We're actually talking about a fourth location also that'll be a little bit closer to Latrobe to help out our Latrobe and Ligonier patients.
That's a great idea.
We're in the early stages of discussing that.
I should mention, yes, also that I'm probably going to be seeing patients at Astique, where I will also be doing a procedure called 10X, where we're able to debride tendons, such as if you have calcific tendonitis of the rotator cuff, or if you have tennis elbow. At Astique, in one of their ambulatory surgical centers, we're able to use a 10X device, which in a matter of minutes we're able to debride unhealthy tissue and tendons, and within 6 weeks have patients getting better from things, as I mentioned, like tennis elbow, plantar fasciitis, Achilles tendonitis, rotator cuff tendinosis, calcific tendonitis. The procedure, actually, I teach medical residents, and I wanted to pull up a video of what the procedure looks like. And when I searched for the procedure, this really nice-looking video came up, and then I discovered it was actually a video that was on the doctors. I think that's the show. Mm-hmm. So if you search for 10X, probably the first thing that's going to come up is this physician doing the procedure on the television show The Doctors for tennis elbow. So if anyone wants to see what it is. Also, I've been doing Cool Leaf at UPMC East. So UPMC East didn't have anybody performing the Cool Leaf procedure. What Cool Leaf is, it's a radiofrequency ablation procedure. And essentially what that means is if you have knee osteoarthritis, and let's say you need a knee replacement, but you don't want to get it yet, or you already had a knee replacement, but you still have pain, we're able to pinpoint the sensory nerves around the knee or around the shoulder, per se, and we're able to ablate those nerves. And essentially, you'll have relief for 6 months to a year until those nerves grow back. And I've been doing that at UPMC East. They've been very good to us. They were very excited to be able to help their patient population as well as mine, and purchase one of those devices and have me utilize it.
I mean, some great technology that's happening for sports medicine pain, shoulders, elbows, knees, hips, neck. I think you see just about everything when you come in. And I just want to back up to that 10X for just a moment. So, tennis elbow has to be one of the most common things that you see, I would imagine. And so can you maybe explain the procedure? Is it ultrasound guided? How does that work?
Yeah, so it is an ultrasound guided procedure. And tennis elbow is a tendon and ligament problem. What happens is that the tendon that's connected to the muscle that extends your wrist and your fingers becomes overused, and over time as we age, the tendon starts to kind of morph into unhealthy tissue. It becomes thickened, it becomes less dense, and that's what we call tendonitis or tendinosis. We're able to visualize that tissue that's thickened and not as dense by using ultrasound. So we would bring you into the Astig Ambulatory Surgical Center. We would find that area with ultrasound. You'd be sterilely prepped and dressed. And then we insert this probe, which is essentially like a needle that moves, I don't remember how many thousands of times a second. And it ejects saline. And from the micro movement of the needle and the force of the saline, it debrides the tissue, the bad tissue, the tissue that's not as dense and, as I mentioned, that's thickened and inflamed, and it actually pulls the tissue out. And the whole procedure takes about 2 minutes, and you're in and out. Recovery time to where you get relief is about 6 weeks. And for tennis elbow, it's a great thing because a lot of doctors use corticosteroid because that's pretty much all that's available. And the problem with corticosteroid is while it can make people feel really good for 4 months or 6 months, studies show that a year later, people actually can get worse than they ever were before and become harder to treat. So that's why 10X is a great process for treating this. Alternatively, for the last 10 years, I've been using prolotherapy or PRP. PRP was made famous by Heinz Ward and Troy Polamalu when they had it done for their MCL. In Super Bowl 40, Heinz Ward, it was thought that he wasn't going to play in the Super Bowl. He had PRP done, and he was able to play and, of course, became the MVP. And then that same thing happened to Troy Polamalu for Super Bowl 43. He had an MCL injury. He had PRP 3 weeks before the Super Bowl and was able to play. So we've been injecting platelets to treat tennis elbow, but it costs money to do it, and it's kind of more painful to do it, and it takes longer to work. So the 10X procedure is covered by insurance.
Very nice. It's so interesting to hear all of these new technologies, and we're going to learn more about them right after our break. You're listening to Westmoreland Community Connections on WHJB.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Westmoreland Community Connections is a presentation of Citizens Fiber.
Welcome back to Westmoreland Community Connections on WHJB. I'm your host, Jennifer Miele. Happy to be here with you today, and two very special guests. Dr. Jacob DiCesare, he's an orthopedic sports medicine physician in Westmoreland County, and his wife, Holly DiCesare, celebrating 1 year in private practice with multiple locations throughout Westmoreland County. He was just discussing the new technologies available to treat tennis elbow and, I believe, MCLs, a procedure called prolotherapy that was made famous by two of Pittsburgh's beloved Steelers right before the Super Bowl. Interesting stuff there. So with the prolotherapy, who would be a good candidate for someone like that, Dr. DiCesare?
Yeah, so Heinz Ward and Troy Polamo, they had PRP done, which is a form of prolotherapy, that's true. But I just want to specify they had PRP done. So for prolotherapy, usually when people talk about prolotherapy, they're referring to injecting hypertonic dextrose. So dextrose is simply a form of sugar, and we concentrate it so it's hypertonic to your own tissue. So your normal tissue concentration is about 10%. Then we mix it to 12.5 or 15%, sometimes 25%. And we use it for tendons, ligaments, and joints. So who is a candidate for that? Basically, anyone who has a problem such as tendonitis or partial tearing of ligaments, like people with ankle sprains. And we use for osteoarthritis as well. There's, people think that is just a cartilage issue, because the patient typically is bone on bone, quote unquote, meaning that they don't have cartilage in one of their compartments. But there's also ligaments that that tether your bones together, and tendons that attach to those bones, and we can treat those with the prolotherapy and make those ligaments and tendons tighter, stronger, and less painful. So we use it not just for tendonitis or partial tearing of ligaments. We also use it for osteoarthritis at different joints. So the age range is I've done prolotherapy on 10-year-old kids with Osgood-Schlatter disease, which it works very well for, or for shin splints, all the way up to patients in their 90s with knee osteoarthritis.
Isn't it amazing? I mean, I'm sure you've seen these technologies just improve so much. Let's talk a little bit about your background, about your education, where you grew up, where you went to school, and why you became interested in sports medicine. Can you talk to us a little bit about that?
Yeah, so my dad's whole family is from Trafford, and my mom is from Lawrenceville, and so I grew up in Penn Township, but I always went to Catholic school. I went to Sacred Heart for a few years, then Cathedral, and then graduated from Greensburg Central Catholic, and I went to school in Southern California. Actually have a master's degree in psychology. I was going to become a psychologist, but I always had this interest in musculoskeletal medicine. So I decided when I was in graduate school that I was going to apply to an osteopathic medical school, and I ended up going to Lake Erie College of Osteopathic Medicine, LECOM in Erie. After that, I did a medicine residency at UPMC, and then sports medicine fellowship with Allegheny, and got a lot of training with their expert orthopedic department, and a lot of the stuff I'm telling you about, the prolotherapy and PRP and musculoskeletal ultrasound. I then worked for 10 years at Excella Orthopedics with all the great doctors there, like Chris Bellassini and Jennifer Erdos and Ralph Passarelli. And I still have a great relationship with all of them, and I still, they help my patients and I help theirs. And I, as you know, went to private practice on the 1st of June 2020, and the rest is history, I guess.
Holly, how did COVID-19 impact patient care, and what were some of the procedures and the precautions that the offices put in place to make sure that patients were still able to be seen, but be seen safely?
Yeah, that's a really good question. Obviously, we implemented the mask protocol, and we actually still wear masks in our office because it hasn't been absolved for physician practices yet. So we are still wearing masks in the office. Jacob was actually vaccinated really early on. As soon as it was available to him, he actually got vaccinated at the end of last year. And then, of course, our cleaning protocol is really intense at this point in terms of door handles, waiting room, that sort of thing. We also were able to space patients out, and we try to make it so that if you're filling out new patient paperwork or whatever the case may be, you're not sitting in the waiting room for an extended period of time. We try to put you in an exam room and have you isolated that way.
Yeah, because even though the world is sort of emerging from the pandemic, there are still variants out there. There are still issues, and you want to make sure patients are safe. But do you see, Dr. DiCesare, more people willing to come into the office now? Are you starting to see the emergence from the pandemic?
Absolutely. I think that after they loosened up on the travel ban in the United States, it seemed like the patients started coming out a lot more. So I feel like it seems to me like it's pretty much back to normal. I mean, we're been busy every day for several months without getting the same amount of phone calls that I would expect, and people don't seem to be as hesitant to come in.
I have a friend who is a cardiologist at Cleveland Clinic in Ohio, and she was saying that the sort of tidal wave of cases is coming because so many people waited so long, and that their conditions are actually much worse, because they weren't being seen by healthcare professionals. Can you speak to that?
Well, I think with what I do, it's a little bit different because even during the pandemic, I feel like my practice in general, we didn't see a huge. Patients still seem to come in, and the reason is that the complaint I usually get is I can't walk or I can't use a hammer, and I'm a carpenter, so they don't really have a choice. They had to come in so that they could live their life. But I could see with a cardiologist where that would make a lot of sense because the person ignores their symptoms and just continues getting chest pain. But in our line of work, I think it did affect us. I don't think it affected us as much, though, as practices where the person's just getting their blood pressure checked or their cholesterol checked and things that they can't feel as much. Because in my line of work, people, and this is what I love about what I do, is I get to make people feel better. So the person has a problem that they're sensing every single day, and I'm able to help them to not have that problem. So they were going to come into me no matter what. So,
and I'm going to make our audience at home chuckle at this. For whatever reason, the stars aligned, and I think a member from each of my extended families was in to see you within 2 days of one another during all this. And you know what? That is a telltale sign. I know my boss, Bishop Kulik, said that means you're all getting old. And now I understand. But one had the shoulder pain, one had the hip pain, one had the knee pain, one had the back pain. And, the whole family. And it's true, because we don't know what is making us hurt. None of us, nobody, you, me, any of us know what is making us hurt until you come in and sort of get that diagnostic workup and see what the opportunity is. And surgery, the possibility of surgery is very scary. And I think another big reason that I would love to do what you do is because you can help stave off surgery to some extent or for a while.
Yes, that's right, Jen. Obviously I don't have anything against surgery, and sometimes it's very helpful, but the fact is that 95% of the patients that come in aren't going to need it. And so we serve a very large population. But the fortunate thing is that if someone does need surgery, I'm able to pick up the phone and call Chris Bellasini and say, hey, here's what I see. Can you help me out here? And he'll accommodate me or Dr. Erdos or doctors from other health systems. I work with the orthopedic group at UPMC and the orthopedic group at Allegheny as well. So we have a really good situation because if you do need surgery, we're also able to accommodate you in that way as well.
Sure, make those excellent and qualified. Yeah, making those excellent qualified referrals is really important. So once again, Dr. Jacob DiCesare is on the line today with his wife, Holly, celebrating 1 year in private practice with locations in Greensburg, Mount Pleasant, and North Huntingdon, talking about some advanced procedures being underway at UPMC East as well as Astique. Holly, why don't you give us the number to call if a patient is interested in an appointment or learning more about some of these advanced procedures?
Sure. And it's one phone number for all three offices, just to clarify that. So no matter what you'd be scheduling, you just call 724-261-4080. And one of the girls will answer and get everybody who needs it scheduled.
And Dr. DiCesare.
And also,
website.
Yeah, I was going to say, we also use a website that you can actually click a button to make an appointment. And the website is greensburgortho.com and has lots of information about all these different procedures, and you can make appointments through the website.
And how about social media?
Holly?
Yes, that is also DiCesare Orthopedic Medicine on Facebook. And then the handle is also Greensburg Ortho to find that one also.
Wonderful. Dr. Jake DiCesare and his wife, Holly, congratulations on 1 year in private practice in all of your locations. We wish you the best of luck, and thanks again for being a guest on Westmoreland Community Connections.
Thanks for having us, Jen.
You're listening to Westmoreland Community Connections on WHJB. I'm your host, Jennifer Miele.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.
Westmoreland Community Connections is a presentation of Citizens Fiber.